Hello, Grand Rapids, and welcome to our digital town hall. I'm Amy Snow Buckner, Communications Director at the city, and I'm so glad you're able to join us. This evening, you'll hear from City Manager Mark Washington and Mayor Rosalynn Bliss on the state of our budget and services in response to COVID-19. But before we get to that, a few housekeeping items. You can submit questions three ways during the town hall. Simply add them to the Facebook comment section, call 311 or 616-456-3000, or text Town Hall to 73224. The mayor and city manager will answer as many questions as possible this evening. The ones they don't get to will be posted on our website at grandrapidsmi.gov/fiscal plan. Please ask a question in a clear and concise manner and hang in there if we have any technical difficulties. We'll do our best to address them quickly. I'll now invite Ms. Griselda Estrada to provide information in Spanish.
Buenas tardes, soy Griselda Estrada. Yo estoy aquí para ayudar con interpretación. Por favor, envíe sus preguntas a través de sección de comentarios de Facebook. Llame al 311 o al 616-456-3000. Envíe un mensaje de texto con las palabras ayuntamiento al 7273224. Le responderemos a tantas preguntas como sea posible durante el evento. Durante las preguntas y respuestas serán respondidas en un resumen de preguntas que serán distribuidas después y se podrán ver en Grand Rapids mi.gov fiscal plan. Haga sus preguntas de manera clara y concisa, ya sea por Facebook, teléfono o mensaje de texto. Por favor, ténganos un poco de paciencia si es que tenemos algún desafío técnico durante este tiempo.
Thanks, Ms. Estrada. Now, without further delay, let's hear from Mayor Bliss.
Good evening, and as Amy Snow Buckner said, welcome to our digital town hall. Like so many things nowadays, we are learning as we go, and so we are hopeful that tonight goes off without a hitch, but if there are glitches, please give us a little bit of grace and patience as we figure those out. So as all of us know, these continue to be unique and really unprecedented times, and so many individuals and business owners and families are really struggling in our community to navigate their way through this pandemic. So tonight we want to take a moment to let you know what we're doing here at City Hall. We worked really hard to respond as quickly as possible, to work with our partners at the county, and also to make sure that our essential services are still being provided to you during this difficult time. Tonight, the city manager is going to present our annual budget. So every year, this time of year, the city commission comes together to hear our city manager present the fiscal budget. Unfortunately, the budget looks quite different than it looked 6 or even 8 weeks ago. Our budget and our direction has changed because of COVID. Just like families and businesses who've had to adjust to the new reality of the financial times that we find ourselves in, the city has had to do that as well. So we are moving into a budget where we're projecting reductions in income tax and sales tax and gas tax, and we have pivoted as quickly and appropriately as we can. I do believe that the budget being presented is a really thoughtful one. You'll hear more about that tonight as our city manager highlights the key points in the budget. And then over the next 4 weeks, our city commission will come together every single week for our budget meetings, and we will be reviewing the budget, and then we'll be adopting the budget by the end of May. So just a reminder that it's our job. We're legally bound to pass a balanced budget every single year, and according to our charter, to have that passed by the end of May, and then that is for a July 1 fiscal start. So we expect, going into the budget that we'll have a lot of good discussion, but we also recognize that as the future is still quite a bit unknown, we may have to come back 3 months from now, 6 months from now, and make additional amendments and changes to our budget. So I want to assure you, though, that we are focusing not just on responding, and we're doing that every day, but we are also looking to the future. So we are already thinking about recovery and about economic revitalization as we move through the phases. We are anticipating that as the economy starts to open again, it'll be done in phases with a primary focus on how do we mitigate the spread of COVID-19. And so we are working through that process. You'll hear tonight the city manager has created an internal recovery team, an incredible group of leaders who work here in the city looking at how we can adjust and help with and do everything we can to support everyone through recovery. And then recently I put together a task force of a number of folks from our community as we come together as a community and think about what do we need to do to really focus on actions that we can take locally to revitalize our local economy. We are so fortunate in this community to have strong partners in so many organizations and really throughout our community who are coming together, not just to respond as quickly as possible to the needs that individuals are experiencing throughout our community, but also individuals who are very committed to being a part of the solution as we move through this and really focus on how do we revitalize our local economy. These are challenging times, and I am convinced that we're going to get through them together. Before I shift over to our city manager to talk a little bit about our budget, and then we'll open it up for questions, I also want to take this moment to thank all of our incredible city staff. We have a lot of essential workers who are out there working 24 hours a day. They haven't stopped through this entire pandemic. I want to thank them for their service and their dedication, along with all of the other folks on the front lines working hard every single day to make sure that we are having our physical and our medical needs met, but then also those who are working to make sure that we have food and other essential products that we need to get through this. So I want to thank you for your service. And we're seeing incredible civic pride also all over our city as people come together to support one another, people who are donating meals to frontline workers, people who are helping their neighbors, people who are volunteering every single day to help other people who are checking on people who are vulnerable. We have lots of sayings in the city that you're seeing pop up, whether that is GR Strong or Love Local GR. That's an initiative we're taking to encourage all of you to support our local businesses. So I know we recently came up with a graphic to try to capture all of those, I'd say, civic pride and sayings that you're starting to see, from the Be the Bridge to In This Together. And so we'll start spreading that out and trying to capture all the civic pride and really beautiful acts of kindness that we're seeing all over this community. So we'll share that graphic with you tonight and hope that you will also share it and continue to do your part, not just to protect yourself and protect your family, but really to come together and make sure that we're protecting everyone in our community. So with that, I'll turn it over to our city manager and let him talk about the budget, and he'll show you that graphic that I just referred to.
Thank you, Mayor. Well, good evening, Grand Rapids. Thank you for tuning in. I also want to echo the sentiments of the mayor and express my appreciation to, first of all the amazing city employees who have been serving very unselfishly and very dedicated in making sure that essential services continue to be provided throughout this response. The trash continues to be picked up, and the water continues to be quality water. All the community is safe. I ask the police chief and fire chief often, is the community safe? And they give me a resounding assurance that it is every time I ask. And for the many employees that are working behind the scenes and providing support services, thank you for your work and your sacrifice in making sure that the public remain safe. And I want to thank all of our partners as well, from the addition to the first responders and essential workers, those that are working at restaurants, and those persons that are assisting medical personnel, and all of you. We're all in this together. And with that, the slide that the mayor mentioned earlier, if we can pull that on the screen, I want to thank our staff, specifically Michael Moore from our planning department, for in our communications director, Ms. Snow Buckner, for running with the many phrases that we have heard. As the mayor said, we're in this together. And the mayor spoke earlier in the movement about Grand Rapids Wave and making sure that we're visible to our neighbors, and let's keep GR strong. And all of the health messages around flattening the curve, maintaining physical distances, being the bridge, and being essential. And I think that's who we are in Grand Rapids. And we're going to try to make sure that we continue to share this as a badge of pride, that we're embracing all of this and not losing our identity, who we are as a community here in Grand Rapids. And so thank you, Mr. Moore, for your work on that. If we can continue with the slides, what I'd like to do tonight is to provide an overview, as the mayor said, around our preliminary fiscal plan. And I shared this with the city commission earlier this week. And I promise I will not take as long as we did used earlier this week to share with you. There's only a few slides, because what we want to do is we want to hear your thoughts and questions. Now, this is not the official public hearing. So if you want to come to the public hearing and have your comments officially recorded, you should do so, and we will have that public hearing on May the 19th at 7 o'clock. But this is our efforts of being very transparent and being accountable. And what you see in this beautiful design as well that our staff has developed is to the right, my right, is our values, our 6 values: accountability, collaboration, customer service, equity, innovation, and sustainability. Those have not changed with this pandemic response, and that's who we are as a workforce. And we try, even in the midst of this, to create a better Grand Rapids, and that's what we show here on the left side in this depicted image. Coming out of the Calder, you see all the things that we are affectionately known as, from Beer City to Furniture City to River City to City of Arts, and to even now being known as the Medical City by some internationally. And we do not intend to lose any of our identity doing that. We are not COVID City. We are still Grand Rapids, and we're very proud of who we not only were, but who we are and who we will continue to be throughout this response. Next slide. And so I spoke about our vision, our values rather, which is also depicted to the left, but also want to just to remind the public that we continue to focus on providing excellent services and improving the quality of life of all residents. And when we began this conversation about how do we prepare, how do we pivot, we went back to the foundation of our strategic plan. And our strategic plan that the commission adopted last year incorporates the vision for our city and our values as an organization, but also our 6 priorities around economic prosperity and affordability and health and safety and our environment and governmental services, governmental excellence around city services, and many other things that we embrace as a city. And what we found out is that when we started responding to this pandemic, nothing has changed. Our values has not changed. Our priorities has changed. Matter of fact, this has amplified the need for us to even focus more on economic prosperity and inclusion, making sure that we deliver service in an equitable way, using our values of innovation to make sure that this crisis, if you will, provides an opportunity for us not to fret, but to be creative. And so we are still standing on those core foundational things as an organization, and that is allowing us to lead forward. And even as we make decisions in this budget, and what you'll see, I'll share with you shortly, are our decisions that we're making around our very strategic priorities using our values. Next slide. So as I mentioned, we have the strong foundation as we begin looking at reducing costs. As the mayor said earlier, like many businesses, and whether small or large employers, the city is we provide public services, but we're also a municipal corporation. And we too have to make sure that we are fiscally prudent in providing public services. And so it has called for us to propose a budget that has been reduced from the previous year's adopted level. But in doing that, we are committed to maintaining essential services And I am very proud of our organization because in less than a month, while responding to this pandemic, while maintaining essential services, we had to rework our annual budget in less than a month. We're doing all three things at once. And there are other organizations, either public or private, that adopts a budget or adopts an operating a spending plan on an annual basis, but it perhaps may be adopted in October, from October to September, or a calendar year, January through December. But our budget has to be adopted by the end of May for a July 1 effective date. So as you can see, we were planning for a different kind of budget prior to the pandemic, one that was based on economic expansion, not contraction, in prosperity. But even with that, we've made some modifications. We are going to continue to build on the reserves that we did add to last year, and we've learned lessons as a community from previous financial crises that we will be prepared. We have been planning for the uncertainty for a long time in our emergency preparedness and financial preparedness, and we are going to continue to maintain the appropriate level of reserves, but we're also going to look at changes that we've made with our equity lens in being inclusive and intentional, as we said in our strategic plan. One of the things we do have in the budget is federal funding, but also we've tried to identify some local funding from the general fund. And so we have a combination of about almost $4 million, $3.75 million. 3.3 million of that is roughly for CDBG and ESG funding from HUD. And we will try to focus on low and moderate income neighborhoods or people who need those services and see how we can be supportive of economic and neighborhood resiliency and recovery. But we'll also try to allocate some unrestricted funding from the general fund, and I'll speak about some of those uses later. Next slide. So just as context, we've learned the state of Michigan has projected shortfall in their budget, and we've heard various numbers from either $1 to $3 billion in the current year and $1 to $4 billion shortfall state spending in the next year. And we've heard reports from Moody's about as little or much of 10 to 14% decrease in the GDP for our state. And we're seeing the impacts of the economy responding to the pandemic locally. I'm looking at the streets now that once were busy and active are barren at this point, and partly is because the businesses are closed. And we saw unemployment go from less than 4% prior to the pandemic to now unofficially over 20%, with over 1 million Michiganders unemployed. Next slide. So this has caused us to be very strategic. And what I'll focus on here, without being redundant, is just the impact. What we've done is we thought our economy was, prior to COVID, was going to expand at, we were projecting revenues for fiscal year 20 to be about 4.5%, or about 4% above the adopted budget for last year. And what we're finding now, we're estimating we're actually going to come in about 3% under, if not more. So we're looking at a net 7% loss of funding minimally for the general fund this year. And we have to figure out how to make that up. And in order to do that, we've reduced spending holistically from a budget that was adopted at $553 million in FY20 to $540 million. That's a $13 million reduction in overall spending. And it appears that we're going to have to reduce even more. So I shared with the commission, we may have to reduce as much as anywhere between 5 and almost 10 million. So that is about a $23 million reduction over last year's adopted budget. But we are poised to do so because we're going to be intentional. We're not going to be reactive. And we're going to make sure that we can do it in a very sustainable way. Next slide. So here are some of the things that we've done. We've instituted a hiring freeze in the organization as of April 17th. Any position that was not already advertised or in the interview process, we have frozen, with some exceptions for public safety, police and fire, and other essential workers. They can be approved by exception, but for non-essential positions and those that were not already in the hiring process, we have frozen. There are no new added positions that are being proposed for fiscal year 21. We've reduced staffing levels, not for full-time regular employees, but for temporary employees. We've made some reduction in staffing. Obviously, we've reduced our costs for travel, or those costs that are associated with travel, and training as well. We're fortunate that right before the pandemic, we had already started a new contract with our health plan that allowed us to save roughly $5.2 million in costs from the previous year's adopted budget. And so where other employers are having to realize those costs immediately by having more direct personnel cuts and affecting employees through immediate referrals or reductions in force, we were able to realize some savings through contract renegotiations on a health plan, as well as some other administrative costs through utilities and insourcing some programs instead of outsourcing. Next slide. Next slide, please. Now, I won't dwell on this very long, but we talked earlier this week about what are some of the proposed capital investments in the budget. And we've been very focused on making sure that there's equity among wards as well as neighborhoods of focus. And so there are three charts here. I'll start with the center one. The first one is around what is the allocations around around wards. And as you can see, for the most part, they're relatively similar in terms of percentages, where the first ward, about 30% of our proposed capital budget is for the first ward, about 32% for the second ward, 38% for the third ward. And the graph to the left depicts what are the investments that are location specific and what are some of those things that are not specific to being constructed or built in a ward, but are intended for citywide usage. And when you see the location specific investments, there's about $46 million, or 62% of all proposed capital investments are location specific. And the graph all the way to the right shows that of that amount, those 46 million that's location specific, about 20 million of that, or 45% of that, are in neighborhoods of focus. Neighborhoods of focus are 17 census tracts that we have here in the city that have been historically underinvested, and they primarily fall within the first and the second ward. First and second ward on the south and near south and the west sides. And so just wanted to share that because I know there's been discussions about, the third ward. Third ward and the second ward. Mayor, now catch me if I'm slipping here.
I just unmuted myself and I was going to correct you. First and third ward, largely.
First and third. Thank you. So thank you for that. So I just wanted to share that. Next slide, please. So around economic prosperity and affordability, we have a couple things I want to highlight. First of all, we have a new economic development director that is going to start with us. We hired Mr. Gracia from Dublin, Ohio, Jeremiah Gracia. He will be starting this summer, hopefully as soon as it's safe to do so with the transition. Announced that hire along with our CFO, Ms. Molly Claren, and our planning director, Ms. Kristen Turkelson. They will be, they're already on board, they were appointed, but the budget includes funding for that position that was vacated by the prior incumbent. It includes our continued partnership with Housing Next and our state land bank, because housing supply and affordable housing is important, and both of those are important strategies as we continue to look at housing affordability. It includes funding support for our retail specialist program. Prior to COVID, we were looking at ways to not only retain retail businesses in Grand Rapids, but also to recruit. But now that focus has changed, and we want to make sure that we are utilizing that partnership with the chamber and with DGRI and other partners in our community to focus on retention. And we appreciate the collaborative work of the Right Place as well in helping us with our retention efforts. We'll also focus on how do we ensure that we can get more MLBEs supported and certified and increase that. And we reported mid-year we had a significant increase in the number of certified MLBEs, and particularly as we talk about long-term financial projects around the Grand River revitalization. How can we make sure that that river for all is not only for people to be a part of in terms of recreation, but also in terms of the development of that corridor. And so we have intentional partnership and collaboration around that as well. I'll go to the next slide, please. Just a couple other highlights. I mentioned before our intention around using some of the federal funding that we've had through the CARES Act, the $3.3 million. Of that, $2.2 million we're going to use for resident resiliency, business recovery, community reactivation, and the other pillar is transportation infrastructure, although we've not been awarded directly any funding from the federal government regarding transportation. Next slide. Regarding safe community, another priority for our strategic plan, we are going to, at this point, the budgets for both the police department and the fire departments were proposed at or above the fiscal 20 level. And we had suggested that we continue to apply for COPS grants for 5 officers. Last year, we added in the general fund the cost for 5 community police officers, and they were used to create a second shift. And so the intent was to apply for 5 officers to continue to support that function along with some other specialty services. And because we have the potential to receive grant funding, the city of Grand Rapids would not absorb the full cost of those 5 officers in the first year, 5 police officers. So you'll see if we are awarded the grant, the local match would require about $264,000 in fiscal year 21, and it continues to increase until fiscal year 24, where the city would have to burden the full cost. And so we projected that 5-year cost, and you'll see it's about $2.4 million over 5 years. I'm so proud of the police department and the fire department for being responsive to the immediate needs during COVID and redeploying current personnel to assist in support for the homeless community and to encourage the appropriate social distancing as well, physical distancing, as well as appropriate referrals to some of the support services. So they have each allocated personnel for the homeless outreach street team. And I am hearing good reports from both the departments as well as our partners in our community. We've also talked to the police chief about potentially using civilians to help with traffic incidents, minor traffic incidents and investigations, so that we would not tie up officer time in responding to those, but perhaps could be redeployed to other higher priority calls. Next slide. I won't spend a lot of time on this as well, but there are other investments that we have that continues to ensure safe communities and our safe community, and you'll see some of those highlighted both out of the general fund as well as some of the leverage funding that we have from other areas. Next slide. On mobility, we have about a little over 5 million that we have budgeted now for the Dash and Route 19. And this is somewhat challenging for us right now because we've suspended the Dash services because of the closures downtown. There's less demand for it, less people utilizing it. And so we'll have to determine whether or not that full planned investment for the Dash needs to continue for next fiscal year. And we're having those conversations. As a matter of fact, next week at our next work session, we'll be talking about our investments in safe community, economic prosperity, affordability, and mobility. As in terms of how much do we need to continue to invest in that. We're challenged right now because with the economic slowdown, there are not people that are parking on street, are not as many people parking on street, not many people parking in the ramps. And so we realize a loss of revenue from some of our parking operations, and we'll have to make adjustments accordingly. However, there is approximately $28 million in funding to continue to work on our infrastructure for streets and sidewalks. And so we are very pleased to continue the progress that we have made in improving the quality of our streets and infrastructure and the level of satisfaction that is garnered. We've seen the results from some of the citizen survey, and even though it is not at the level that we want to be, we have many of our streets, over 60% of our streets that are in good or better condition. And so we're real proud of that. Next slide. And we continue to invest in things that affect health and environment, particularly now in this environment around COVID, and making sure that people have access to safe and clean drinking water, usable water to wash hands as recommended by our health professionals. We continue to make sure that we've invested in whether that is in our lead service line replacement program, our PFAS testing, or even in making sure that we are doing things innovatively around completion of the biodigestion project in terms of having renewable energy. I do want to say a couple things around park and pool operations. That is another area we'll be looking at in the future in determining what the appropriate level of investment is. Pools have been closed and continue to be closed until the foreseeable future. That may be an area where we may be able to reduce the amount of operational investment moving forward. Next slide, please. And the next area around engage and connected community, what we realize that it's important, particularly now that physical distancing, social distancing is in place. Many people are engaging government and other services differently, using a lot of electronic means and engagement. And we have made sure that we can inclusively engage people, whether it is through investing in publications, but doing so to make sure that we're communicating in multiple languages, either in writing or in translation services or interpretation services. And we have made sure that we are able to connect with residents in a way that is meaningful to them. And so we are continuing to invest in our engagement and communication efforts, both at the corporate level, but also corporate communications, but also make sure that we do so in a meaningful way within the neighborhoods. Next slide. And finally, technology is very important. So we have to make sure that we have good technology that will allow us to make data readily available for decision, but also for transparency, and that we have open data by default, but we also have methods and ways of making sure that our data is secured and with preventing cyber crimes and cyber issues. As well as you'll see on the right side, we've also talked about continuing our efforts for master plan scoping, That's part of our future. That's part of our long-term recovery, envisioning what kind of community we're going to have for the future, as well as making sure that we do things in a very equitable way within our organization in terms of making sure that the organization continues to reflect the community that we serve, whether it's hiring or the competence, cultural competence that is needed to engage with the public and making sure that we have resources to engage with our legislatures, both at the state and federal level, as we're seeing assistance that is being provided either from Washington or from Lansing that will help local governments and local economies recover sooner than later. So those investments are listed on the slide in front of me. So with that, I think that is the last slide that I intend to cover at this point. And we can pause there and go into questions, and then we can conclude about the actual budget schedule. So we can take the slides down. And Amy, if I'll turn it back over to you and see if well, before I do that, Mayor, is there anything else you'd like to add before we start taking questions?
No, I think you hit all of the key highlights, and I'm impressed you were able to do that in such a short time, considering we spent a couple hours on this on Tuesday. So nice job.
Thank you.
Yes, thank you, City Manager and Mayor. So just a reminder, if you're just joining us, you can submit questions 3 ways during the town hall. Simply add them to the Facebook comment section. Call 311 or 616-456-3000 or text town hall to 73224. All right, let's get to the questions. So the first question this evening is, many years ago, the city offered early retirement to employees who were eligible. Could this be a consideration to save money?
It is. I'll take that one. It is. And it's one that we have thought about, and it is one that's on the table. But I want to be careful in doing that because attrition needs to not only be thought of financially, but it needs to be thought of strategically. We need to make sure that we don't have undesired turnover, but because we have a lot of talented people, and that is something that we want to make sure that we maintain as an organization. But to answer the question, it is one of the things that we are considering.
All right, thank you, City Manager. Next question. How does the fiscal year 2021 budgeted funds for affordable housing compare to those budgeted in fiscal year 2020?
So in terms of a couple of things. One, in terms of the Affordable Housing Fund, we talked about that today, the actual fund that was adopted. We're talking about its planned uses. And I think what hadn't even had a chance to talk to the mayor yet, so don't look too surprised. But I think one of the things we're contemplating is how can we, we're trying to use those funds for more long-term projects, but now with the COVID crisis, we actually talked here recently about perhaps using some of that in a more short-term basis for relief. So that's a potential option. The other regarding the budget for some of the other efforts, I think all the authority budgets, at least what we've seen so far, remain the same. I'm not aware of any reduction in those budgets, and there are no planned reductions of any other efforts that I'm aware of within our current proposed budget regarding housing.
All right, thank you, City Manager. Next question. So with city offices, city buildings closed right now, where can residents get blue trash bags?
Amy, I'm going to ask you to help me out.
Well, you can order them online, correct? You can get blue trash bags online, and you can order yard waste tags online. So you can go to the city website and it'll take you, you can click on a page and it'll come up and you can order those, and then we'll send them to you. Amy,
See, I knew I'd find a question for you, Mayor. There you go.
Well,
right.
well, and the mayor knows that for sure because the mayor has been working in her yard.
That's absolutely right. All right, next question. Is the city health insurance looking at extending the time allowed for dependents who are turning 26 during this pandemic, but have not been allowed to get into previously scheduled preventative dentist and doctor appointments for the past 6 weeks because of the shutdowns?
That's the first I've heard of that concern, and have not had any discussions around that. But that's a question that we can certainly forward to our HR department and have see if we can get a response to that. I think we intend to post questions publicly, the questions that are asked, correct? The responses to them.
That is correct. Yes, yes. So next question. Will there be any funds going to entrepreneurs in the third ward to help them with startups or continue running their businesses?
Yeah, thank you for the question. I think we have proposed in the budget, and I didn't highlight this, and I because it just so much compressed a short amount of time is we have roughly $232,000 that we have proposed for the continuation of the third ward equity fund. And so that's what's in the proposed budget at this point to help businesses for resiliency and support. And so the funding has to be approved, and then the program for it has to be developed and continued. And so those are possibilities with potential use of that fund.
All right, thank you. So next question. So you've spoken about the reductions. Where are you thinking of making those budget reductions?
Now, the ones that we've already proposed around the reductions in healthcare costs and reductions to efficiencies, we've already made those. The new needed reductions, the almost $10 million in additional reductions, we are working through that as we speak. I've asked every department to submit proposals for those reductions. We'll be reviewing that tomorrow and Monday, and then I will be proposing some of them based on our review with the commission as we go through this various workshops. We'll probably start talking about some of the first series of reductions on next Tuesday.
All right, here's another question. Can we also order large item garbage tags online?
I believe that we can order all the tags. No, you can't. I see. Amy, why don't you answer that? I use bags and yard waste, but I haven't tried to order tags online.
Yeah, so we are obviously piloting this, and we're hopeful that we can expand the number of items that we can offer online. But right now, that those large item garbage tags are not available for purchase online. But stay tuned for an update on that for sure.
Amy, can you add though? People can still order carts. And
that is correct.
Yeah, so as a resident, you can still order recycling cart, yard waste cart, refuse cart. So that is still available, and we would deliver that. You would set up an account, and so that is also available. So if you don't have one of those items, one of the carts, you can still get one.
Absolutely, yes. So next question, how will the hiring freeze impact staffing in the new Office of Oversight and Accountability, as well as the proposed budget for that office?
Well, right now, the hiring freeze has no impact on it because the position was recruited and screened and vetted prior to the hiring freeze. And so we're actually in the finalist stage. We have 3 announced finalists, and they're set, I believe, to be vetted or viewed by the community on next Monday. And so this has been something that has been recommended both by external consultants as well as requested by community. And so I think there's several aspects to safety, keeping the community safe. And so just like I exempted the safety, public safety elements around police and fire, I consider the oversight office also a part of public safety. And so they receive equivalent exemption. So my plans are to proceed with the hiring of that position.
And city manager, can I also add to that? I want to add that that position was also strongly supported by the majority of the city commission. So it's a priority also to the city commission. And so I appreciate that question.
All right, thank you. And I've been getting updates as of right now, or just a second ago. We did not have any calls, but I just want to check in with Kevin to make sure that we don't have anyone in the call queue. Kevin, is that correct?
That is correct. At this time, we do not have any calls on the queue.
Okay, thank you. So next question. Why not support cannabis business as a source of revenue, being both medical and recreational, since it's legal and deemed essential?
I think that's a good question. I'll respond from the staff perspective, and Mayor, you can respond from the commission perspective. And I think that's what our plans are. We want to support both. We've already permitted licensed medical, and we're working on our strategy to do so for recreational. And yes, we realize the potential revenue benefit or enhancements or the economic benefit. I shared that graphic earlier, and I talked, and it had a slide with the agricultural and what's needed to make beer for Beer City. But reality is, with what we're experiencing, we're not only Beer City, but we're part of Bud City as well, with marijuana. And so that is an economic reality, and it will be a important part of our economy. And we want to be supportive of all industries indiscriminately. And so that's what we're doing from a staff perspective, but we're following policy. And what our city commissioners have elected to do was to ask staff to take more time to look at our both licensing and land use provisions around recreational marijuana, and to do so in a very using our equity lens. We talked about our values around that before, and that's exactly what we're doing at this time. Mayor?
Yeah, you said it perfectly, but I'll just reiterate that we are still moving forward with medical marijuana approvals. So our planning commission, they still have applications lined up. Our planning commission is still hearing those. People are still weighing in during public comment period. So everything is still moving forward as is under the medical marijuana licensing process. And then for recreational, this is something the city commission decided we need more time on, and we want to make sure that we don't rush into it, but we really think through the land use. And as the city manager said, how do we do that with a real focus on local and with an equity lens? And then also there's a lot of different opinions in the community that we need to make sure we take time to hear. Thank you for that question.
Great, thank you both. Next question. Is the option of reducing costs going to include working with unions to allow employees to work from home more steadily, as it's been proven possible to do during this pandemic? And then the second part of that question is this even possible with the fact that we just did contract negotiations?
Well, let's talk about what we're doing now and doing without having negotiated. I think what this pandemic has taught us is how to value innovation and collaboration. And we had to very quickly accelerate our plans for teleworking, telecommuting. In the latest report that I got, where we had about 40% or so of our workforce that was teleworking, and before we were only going to pilot it with one group of employees. That was probably less than 10% of that number. And so we're still evaluating the effectiveness and making sure that we are getting 100% of the work based on 100% of the pay. And there's a group, a team that's looking at that, and to make sure that it's applicable in every area. But yeah, if it works during COVID, I don't see why not. We would want to continue doing what's working outside of it. But I can't categorically say that, uncategorically say that for every area. We have to evaluate and see if it makes sense. And unfortunately, there are some employees that cannot work remotely. They have to work on site, and but I think that's the way our economy is moving, and we want to embrace as much as we can to become a digital employer.
All right. Thank you, City Manager. It sounds like we do have a caller in the queue. So Kevin? Maybe we're having some technical difficulties. All right, let me throw another question your way. As a contract employee for the city, should I be concerned that my position could be at risk if budget cuts are made?
Can someone call and ask the mayor some questions, please?
Happy to answer questions.
I think there are a few in the queue. I think.
Yeah. So thank you. So a couple of things. One, right now there are no proposals on the table to reduce the workforce. We have been very, very mindful of trying to do all that we can to make that the last resort. Coming in, I was sensitized to the fact that this organization had gone through several periods of economic where the economic environment has put stress on the organizational financials and has experienced several reductions in force. And even our current staffing levels are not at the levels that it was in 2008, I believe, or even prior to that in 2000. So we're just now starting to get back to where we were prior to the last fiscal cliff. Having said that, as we go through COVID, it's uncertain. We don't know how long or how severe this is going to have. The biggest relief will be to reopen the economy and to reopen it as soon as possible. However, we can't do that without being concerned about safety. So as long as the economy remains like it is now, I have to look at all cost saving measures, but I don't want to be short sighted. So right now we're hoping that we can have a as expedient as possible of a recovery. I'll give you an example. The reason why I'm taking the long view of things. Had we made decisions around furloughs or workforce reductions last week or the week before last, there would have been people in golf operations that could have been potentially impacted because the golf courses were closed. Well, last Friday, the governor made a decision to allow the golf courses to reopen. And because we did not have drastic staff changes, that was announced Friday afternoon, and by Saturday morning we were able to pivot and have the courses open for play. Had we reacted in a much more drastic way, we would not have had that ability. And so we're taking a measured approach, deliberate approach. I don't want to overpromise, don't want to underpromise, but just know that we're doing all we can to sustain essential city operations. Now, there may be some places in our operations where it is not operable, and it may not be operable for the long term. If downtown stays like it is right now for long term, nobody's parking. We're going to have to we are seriously looking at our parking operations, but our commitment, as many of those employees have seen, we redeploy them in other areas of the organization where they can be utilized in doing other work. And so part of that was made made possible by our collaboration with the unions, where we had an MOU and had the ability to reassign other staff.
All right, thank you, City Manager. So it sounds like perhaps the caller may have decided not to ask a question, but I just want to double check with Kevin to make sure that that is the case and that we do not have a caller in the queue.
That is correct. It looks like the call was dropped, so there's no current phone calls on the queue.
Okay, thank you so much, Kevin.
No problem.
All right, next question. The commissioned Grand Rapids Police Department staffing study from last year said we did not need to hire more police officers, rather that we needed support staff. Given that we are seeing such a drastic reduction in the general fund, as well as upcoming liability costs around retirements, how do we justify a $2.4 million cost after the COPS grant runs out to hire more officers when we've openly stated that they are not needed for public safety?
I am going to let the mayor respond first, and then I'll go second on this one.
All right, thank you. Well, I appreciate you bringing up the deployment study because we do refer back to that quite often, and there has been some work to implement some of that. So last year, the City Commission, we added some positions for civilians as well as added some crime technicians. And that came directly from the deployment study. With the COPS grant, one thing we've heard pretty loud and clear is the need to expand community policing into the evenings and the weekend. And we did that with adding some adding kind of shifting officers around to make that a possibility. So, COPS grants come up. We don't always get them. I can tell you, the City Commission, we haven't decided as of yet if we will support that recommendation. It's one of the recommendations that's in the city manager's budget. And that's what it is. So the budget that's being presented is a recommendation from the city manager, and the City Commission needs to work through that. So that is one recommendation in there. And it'll really be up to the City Commission to make the decision whether they support allocating those funds over the next 5 years in order to try to leverage the federal dollars to support those 5 positions. I can tell you, historically, we have taken advantage of COPS grants because you are able to offset costs of positions. And so that has been our practice in the past. So it's not unprecedented that we would continue to seek funds through the COPS grant program. But that's my initial reaction to the question. But it's a very good question.
Yeah, and Mayor, and let me just offer a little bit more information on what's actually in the budget. We forecasted the cost, and it's conditional, so we haven't assumed any general fund costs in this budget because we have to be awarded the grant, and should we be awarded, we would then match the appropriations, but we have to plan for it. So the current proposal, it's a consideration, but we did not factor that into the economics of the current budget.
All right, thank you both. Next question. As we look at the new online learning initiative, Grand Rapids Public Schools has worked so hard to get rolled out. What are your thoughts, ideas on citywide internet?
Well, I'll jump in and then I'll let the city manager jump in. We actually have been in conversations about citywide Wi-Fi and access to internet. We know that is a disparity that exists in our community and that there are neighborhoods that don't have access. So we have actually been in conversations with a number of community partners, really thinking about what could that potentially look like. I would love to see that happen. It's costly. So again, we have to figure out how could we make that happen and with what resources. But to me, it's one of those things we need to keep on the table and continue to work towards. And I know the city manager has been, and his assistant city manager, they have been in active conversations about this. So I'll let him add.
Well, Mary, you're exactly right. And so we have been looking at ways how we can collectively address the digital divide, and perhaps Wi-Fi can be activated in some public spaces, whether it is continue to utilize the school district properties or areas where the schools are, the neighborhoods are there, our infrastructure, even on city-owned property, whether it's city parks building or even the Calder. I tried to have a meeting outside last week, and Ms. Snow Buckner was part of that, and I could not go outside of the foyer because the Wi-Fi didn't extend out that far. And so I think looking at places where there's um, inequitable access to technology in those specific neighborhoods, and maybe we start with the neighborhoods and focus. That was one of the other areas, and how we can be more public around it. I know that there's been other communities that have looked at making mobile Wi-Fi and attaching Wi-Fi to school buses or city apparatus for the public to engage. Those are all discussions, but they come at a cost. And so we'll have to continue to assess that. And we've talked to our staff about doing some kind of digital assessment. And we need facts around specific areas where the need is the most.
All right, thank you, City Manager. So it's just after 6. We do have a few more questions. Are you good with hanging on for a few more minutes to get through all the questions?
We're just getting warmed up. I have some questions for the mayor, and I have some questions for you as well.
Oh, great. I look forward to that. All right, next question. Is the city looking to address any systemic reasons in Grand Rapids for racial disparities in susceptibility to COVID-19?
Yeah. City Manager, do you want me to start on this one?
Sure.
You know, our city, like many cities, we've had, there's been deep racial disparities historically. And we have talked a lot about how do we start to really eliminate racial disparities that exist in our community. And COVID has amplified the disparities that exist, especially when it comes to social determinants of health. So this has been a conversation that we have had and are continuing to have with our county health department, the health department, as well as our local hospitals. And what can we do to be a partner to really look at those systemic issues around access and housing, access to healthcare, building trust, and so it's a huge task, and we can't do it alone. But I believe we have some great partners who are also committed to this work. And to me, what's happening with COVID is an indication and an affirmation that the work we have been doing around racial disparities continues to be a top priority. City Manager, you've been involved in these conversations.
Well, yeah, I think you've identified at least what our approach has been. The city is not the public health authority. And, I've worked in cities where the city was both the authority on public safety and public health. Here, the county is the lead agency on public health. However, there are impacts of poor public health that affect other areas. It affects economic health, it affects educational well-being, and it is all those issues that cause further disparities in the community. And we've known that there's been, I'm getting a little echo from someone on my end. If you can put your mics on, there you go. We've known that we've had those disproportional health outcomes. It's now only amplified through COVID. So I applaud the county for publishing the data that shows the disparity in Kent County, where people of color are disproportionately represented. I think the county has taken the next step in trying to have conversations with communities of color. We too have a responsibility in helping to address those issues. And what you'll see in at least around our thoughts around some of the CDBG funding is to at least talk about from the income perspective, so what are some of those things that contribute to poor health outcomes, and many times they're related to poverty. So although we may not be able to address them on the clinical side, we can address them on some of the other contributing factors to poor health, and that affects one's economic well-being and prosperity. So we do see that we have a responsibility to be partners, but I want to be clear: we are not the data scientists or the epidemiologists or the clinical nurses that coordinate treatment and outcomes. That is not the city's role, but we from a policy perspective, public policy perspective, and from being concerned about what happens in the well-being of our community, we are equally concerned about those outcomes, even though we're not the primary providers.
All right, thank you, City Manager. Next question. In regards to the Paycheck Protection Program, is the city advocating with local banks to prioritize small businesses this time around?
Yes. In fact, I just had a lengthy conversation with one of our banks this morning. I continue to talk to them, and so do a number of our partners in the community that we're partnering with to try to make sure that all of our local small businesses have access to those resources.
Yeah, I was going to just add that that's also part of the focus of our recovery team, as well as to be advocates as much as possible for support for local businesses.
All right, thank you both. So this is a two-parter. Is there a formal submission process for both long-term and short-term affordable housing projects? And what is the entry point for proper consideration?
So I guess a couple of things. One, for any economic development project, and what support there might be, both from city, local support, or other economic development tools, the entry process would begin with a conversation with our economic development office and having them work with whoever the developer is on the project to talk about the goals of the project, whether it's around housing or it's around, I mean, whatever the housing is, whether it's affordable housing, at what level of affordability, or what other goals that the project would have. I think our office would be the starting point to have those conversations, and then to see if there's any tools that the city could be supportive of, as well as coordinate with some of our authorities in the various parts of the city. And so that would be the entry part of those discussions.
And yeah, I'll just add, the city, we continue to support and partner with our nonprofit housing organizations as well. You know, we are actively supporting applications for low-income housing tax credits, and that's a competitive state process. And we come alongside those organizations who are seeking out those credits to build, in order to build low-income housing. And we have aggressively advocated at the state level for projects, and so we'll continue to do that as well.
All right, thank you both. Okay, just three more questions. So, it's great. I love the engagement.
Five. Don't forget my two at the end.
That's right. That's right. Oh, wait, we might have to cut the feed after that. Are other positions that previously were approved by civil service, such as the compensation specialist and assistant human resources director, impacted by the hiring freeze?
I don't know the answer to that. I don't know where those positions are in the process. So if there was a recruitment that already started for those positions, then they could continue. But if they have not, if those positions were approved but there was no hiring activity, then they would be subject to the conditions of the hiring.
All right, thank you. Next question. How does one go about filing for the economic impact payment? Not been able to file a tax return yet due to moving shortly after the new year and waiting on W-2s to come to a new address. Went online, but obviously was not able to file for that because of the lack of a W-2. So where can folks go to get more information about the economic impact payments?
Well, I don't have a specific answer on the uniquenesses of their circumstances. And so what we can do is follow up on the question and have that posted online. And what I think I heard you say is that the person doesn't have the W-2 and has changed residence quite a few times.
That's correct.
And
Yes, most definitely can follow up on that.
Yeah, we'll,
and, and the economic and what? Repeat the question again, please.
I believe they're referring to the $1,200 relief check that people are being sent from the
Okay.
federal government. So we'll have to follow up on that because that is a federal relief. We'll have to follow up and get you the accurate information. I have a sense of where you could go for help, but we better double check and then we'll get back to you.
Great. Thank you both. Okay, last question of the evening. Please comment on how allowing tax exempt businesses such as churches who are able to collect benefits under the Payment Protection Program have been allowed in Grand Rapids to prevent tax paying businesses from giving much needed jobs to contractors during this crisis.
That's similar to the mayor's last question. That's a federal eligibility question, and I think what the caller is saying, and I appreciate that because tax exempt on the property taxes, but those businesses that are nonprofits still are employers, and they have to pay payroll taxes and income to their employees, which does allow some income taxes to be received by the city. So perhaps on the property side, we're unable to capture some benefit from nonprofits, but for those that have those that have sizable employment, they do contribute to the economic vitality of our community by one, keeping someone employed, and by two, paying income taxes on that, which is the largest portion, one of the largest portion of our revenue sources for a city.
All right, thank you, City Manager. Before we close the Q&A portion, I just want to check one more time with Kevin to make sure we don't have anyone in the call queue.
That is correct. At this time, we don't have any calls in the call queue.
Okay, thank you so much, Kevin, for your help this evening.
No problem at all.
All right, City Manager, what's your question?
My two questions. First, so pull back up that slide on the GR.
Slide.
Yes,
All right, Mr. Start, you're at the
Yeah.
controls.
the GR slide. Mayor,
Yes.
this is a very important question. Your whole political career could hinge on this question.
I'm filling it out, so I'm not too worried about that.
What speaks to you the most there and why?
Oh, that's a great question because there's so many. I love this image because it captures so much of what's beautiful about our city. I think what jumps out to me the most and what resonates with me is the Love Local GR. I'm very, very concerned about our local businesses right now, and I think it's important that we all do everything we can to support all things local, and then also, there's something about loving GR that resonates with me because I see all the love that people are displaying right now every single day.
Very good. Okay, Ms. Snow Buckner, what speaks to you the most and why? Caller, I have a couple of more callers here on the line.
Thanks, City Manager. So I think in this together, because it doesn't matter who you are, what you do, where you are in the city, we truly are in this together. And I think one of the great things about our community is that we work really hard and well together. We have beautiful partnerships. And we are resilient and we will get through this. I believe that deep down in my heart. And so in this together really speaks to me.
Very good.
City Manager, how about you?
Okay, since I designed this exercise, I get to pick two.
Fair.
Yeah, I think the first is as an organization is essential workers, and recognizing the people who are on the front line, who are really making that sacrifice to combat COVID-19 and then also provide essential services. And then, and I guess the other is flatten the curve, because until we do that, I mean, that's the goal. That is the goal. We got to keep the goal in mind, and we got to do whatever is necessary, whether that is continuing personal hygiene, whether it is making sure we maintain the appropriate physical distancing, whether it is just advancing medical technology. We have to do what we can to flatten the curve, and so that's my hope. And it seems like we're making progress. And as soon as we can get beyond this, we can go back to where we left off, and continue to build this on this resilient community that we once were. That we still are, rather, not once were, still are.
Absolutely. Absolutely. Well, I think that's a beautiful way to end this digital town hall.
Yes. Thank you, everyone, for joining us. Stay safe.
Support.
Have a good night.
Take care.
Thank you.